the escape, News 5 is always investigating, and tonight we're asking questions after a man with dementia simply walked out of his Northeast Ohio nursing home and was found dead 2 days later. 56-year-old Mark Billiter left Sunday night, but he wasn't reported missing by the nursing home until the next day. In between, Billiter actually got a ride from a police officer who had no idea the man with memory issues has slipped away from a home. Bob Jones live tonight at Glenwood Care and Rehabilitation in Canton. And Bob, the man's family says that the death could have been prevented.
Well, the family told me they've been advised not to comment, but an attorney says relatives are heartbroken and a lawsuit will be filed. That attorney believes that if this nursing home had filed a missing persons report in a timely manner, that man would still be alive.
Can't walk on the highway anyway.
This is body camera video capturing a Canton cop talking to Mark Billiter around 10:30 Sunday night.
What's your name, dude?
Mark.
Mark what? Billington?
There was concern for Billiter's safety because he was walking in dark clothing near a US 62 on-ramp. The cop offered to give Billiter a ride in Canton, but he repeatedly asked to go to a relative's home in Alliance.
Huh? I can't take you to Alliance. I've done told you that 3 times. I can't take you to Alliance.
What the officer didn't know was that Billiter, a dementia patient at Glenwood Care and Rehabilitation, had escaped from there about 2 hours earlier.
In this case, had contact been made timely, this tragedy would have been avoided.
Tracy Laszlo, the attorney representing the family, says Billiter was staying in a locked part of the nursing home specific for dementia patients because he was an escape risk and had made other escape attempts. Laszlo believes a nursing home worker opened a door, allowing Billiter to follow a visitor to another patient out the door. But the nursing home didn't notify the family Billiter was missing until 12 hours later, 7 a.m. Monday.
They failed to do a perimeter search. They failed to contact the family immediately.
And it was the family who called Canton police Monday morning to report their loved one missing.
All right, man, I'm gonna let you out up here. We're out of the city limits.
By then, more than 8 hours had passed since that officer had dropped off Billiter at the city limits, still 12 miles away from the family home in Alliance he was trying to get to.
All right, man. Best of luck, all right?
Yeah, thank you.
Yep, be safe, okay?
Tragically, on Tuesday afternoon, Billiter's body was found by a gas station, not far from where the police left him.
There's a gentleman that is, I don't know if he's alive or dead.
Investigators believe he died from exposure to the cold.
The family's just thankful for the prayers of the community.
Canton police say dispatch was notified of the drop-off, but a separate police report detailing the contact with Billiter was not made because reports are usually only filed when police investigate complaints or crimes. Laszlo believes police did all they could to help since they didn't know Billiter was a missing man. But Laszlo strongly feels Glenwood Care and Rehabilitation failed a patient with dementia.
There are really good nursing homes that provide excellent care. And then there are nursing homes who fail to follow protocols. And this type of tragedy is what results.
Canton police would not discuss this case on camera, but they did say it's not uncommon for officers to give people rides, but policy prevents them from going outside of the city limits. As for the nursing home here, they said they have no comments because it remains under investigation. Live in Canton, Bob Jones, News 5.
All right, thank you, Bob. And our investigative team has also been digging into Glenwood Care and Rehabilitation's federal and state inspection records. On your side, Chief Investigator Ron Regan joins us now live. And Ron, you found out that this is not the first time that questions have been raised about the safety of the patients.
Yeah, according to inspection records 2 years ago, safety was a concern. And so was staffing. The Department of Health says twice in 2016, 2 different nurses told them the dementia unit was sometimes understaffed on the night shift, which was a time when residents would get confused and try to leave. Glenwood planned to correct the problem by making sure there were at least 2 people working in that dementia unit at all times. Now, the federal government also rates nursing homes. The Centers for Medicare and Medicaid rank the facility much below average in both health inspections and staffing. Quality of care was ranked average, but the facility has not received any fines in the last 3 years. Now, these rankings were based on inspections over the last 3 years prior to last November. I'm Chief Investigator Ron Regan.